Hello and welcome to this hints and tips video for GP practices sending records into storage. My name is Ryan Taylor and I work within the communications team at PCSE.
And my name is Kat Van Paris and I work within the patient services team at PCSE. So when you are moving a patient's records into storage, a number of things need to be completed in order for PCSE to successfully store the record. Any discrepancies in the record can delay this process and lead to additional work needing to be carried out.
So in this video, we'll be giving you an insight into how record movements need to be submitted and completed in order to avoid any unnecessary delays in storing a patient's record. So let's get started.
So when it comes to how to send the records, can you give us some further detail as to how the process of preparing and sending the records is supposed to be done by the GP practice?
Sure, so PCSE is actually responsible for the movement of any physical records once a deducting practice or the practice that a patient is leaving from has released the record to their City Sprint courier. And effectively, it's done in 4 simple steps. So step 1 is generating a label. Tracking labels are generated automatically when you accept the deduction on your clinical system. These labels are printed and delivered by our courier, City Sprint. Step 2 of this process is bagging the record. So when the label arrives, you need to put the record in a shipping bag. Then we go on to step 3, where you attach the label. So you attach the right-hand label to the shipping bag in the box labelled NHS staff affix address label here. And finally, step 4, the record should then be collected by our courier, City Sprint, within the following week. So, Kat, when a practice receives a deduction for one of their patients, what of the records actually must be sent into storage?
Yeah, sure. So the full records must be sent to PCSE in order to action any SAR requests for medical records or an AHR request for a deceased patient's medical records. And these should be comprised of the full paper records, the full and complete electronic summary, and also any scanned documents and attachments, for example, any hospital letters or reports. The records submitted should not contain any CDs, as these cannot be accessed, and they should not contain multiple pages of text submitted per A4 sheet. So in addition to the paper records, the full and complete electronic summary must be submitted. Can you give us any tips on the right way to do this?
Sure. So first of all, this should be a printed copy of all the electronic records held for that particular patient. This should include any hospital letters as well. The pages must be printed 1 page per A4 in order for the NHSE health professional to authorise the release of the records. In order for the records as well to be released, the health professional must be able to ensure that they refer to the correct patient and is able to read the medical notes. If the records are not legible, for example, the health professional cannot authorise the release of the records. If the records were to be released to yourselves and they were found to reference another patient or release data outside of the scope of the application, this would actually be a breach of patient confidentiality. So, Kat, in terms of a patient's medical record, what exactly does PCSE hold?
So PCSE only holds the records for deceased or deregistered patients, and this is on behalf of NHSE. And these are any records which are submitted in paper format, including any electronic summaries that have been printed. So what is PCSE's role in regards to storing a patient's medical records?
So as well as holding the records in storage for NHS England, PCSE receive requests for deceased and unregistered patients' medical records. As an example, SARS, so subject access requests, and AHRs, access to health records. To action these requests, we copy the records as held in storage and send these to an NHSE health professional to authorise the disclosure. They will also confirm whether the records appear incomplete or contain any illegible information. So what happens if missing or illegible records are sent?
So if records are found to be incomplete, either missing or illegible by the NHSE health professional, PCSE will inform the applicant that we do not hold this missing information and provide the details of the last registered practice of the deceased. PCSE cannot provide access to medical records which we do not hold. So the NHS health professional cannot authorise the release of records which are either not held or they contain illegible information. Practices remain legally responsible for copies of records retained on their systems. Even if the surgery have changed systems several years ago, they are legally obliged to retain a patient's medical records. Where a practice retains a copy of a patient's record, whether it be paper or electronic, they are legally required to consider a request for medical records. The surgery is obliged to respond directly if an applicant insists on accessing data retained by the practice. So if any records are still held by the practice and PCSE do not have these, the applicant will be directed to the last practice. So if a GP is approached by an applicant, can the records be provided directly to PCSE?
Of course, so if you're actually approached by an applicant to whom it has been confirmed the records are incomplete, you must respond to their request. However, you may wish to send the missing records to PCSE so that we may both hold the complete records and be in a position to provide the full records to NHS England health professional to consider when authorising the release of the records. If you intend to send the records to PCSE so that we may action the request, please advise the applicant as such and that they will need to contact PCSE for access to the records. We will be able to track the movement of the records and advise the applicant accordingly. So what if the records have been collected from the practice?
So if an applicant has been advised records are incomplete upon requesting them from PCSE and then been directed to approach your practice, PCSE will have already confirmed that some records are held for the patient. However, it is these records which have been received into storage that will have been determined to be incomplete or illegible.
So finally, why else might an applicant be directed to a medical practice?
So if PCSE receive a request for medical records and the records are yet to be submitted to storage, we will direct the applicant to the last practice. The records may well have been collected by PCSE when the applicant approaches yourself. If this is the case, please inform the applicant that this has been done and advise the applicant to approach PCSE. We can only process requests when we are in possession of the records. Until this point, however, the applicant will be directed to the last practice.